Good evening and welcome to today's event. And I'd like to say Happy Women's Day to women everywhere. But that is a loaded sort of statement as far as I'm concerned, because while we have a lot to celebrate about women, we have a long way to go as far as women's well-being, safety, and um, overall sense of worth is concerned. And so here we are to unpack possibly a very difficult topic, but a very, very important one. And I'm really glad that we're all here today. And those of you who made the time to be part of this webinar, thank you very much. We'll just get started with a short video, after which we will go right into the discussions directly. So may I please request our IT team?
How can it be that the first and most effective line of defense against one of the deadliest and most painful cancers is the simple act of knowing? Cervical cancer in India is not a disease of only the impoverished. It is a disease of the unaware. Privilege and poverty both fall prey to it, and for each life afflicted, there are caregivers affected. Stigma around this cancer leads to silence, and the silence is lethal. It claims the lives of more women than any other cancer. It ravages their bodies and lives in ways inexplicable. This need not be, but it is. Palliative care can help if only one knew to ask for it. It is the only kind of cancer in the world today that has not one, but 2 vaccines that can completely prevent it. It can be easily screened for, and if caught, can be stopped in its tracks. But great science, without awareness, cannot overcome this. Let's take back the spaces cervical cancer has claimed. Let's honor these faces who are living and dying with it.
Thank you. So cervical cancer is a topic that is very close to many of our hearts. And I think that sort of underscores the fact that cervical cancer is rampant in our country. And the sheer number, the sheer prevalence of this disease warrants its prioritization. And I think the greatest paradox about this is that it is the only 100% preventable cancer in the world. That most women in India dying of cancer die of this particular cancer is a travesty. So I'm really pleased to have with us today 4 people who will be helping us talk about this illness in different ways, will be approaching it from different angles. And without wasting any more time, I'd like to introduce you to our first speaker, Mridu. Mridu is a serial entrepreneur and a seasoned development sector leader with over 25 years of experience. She has led many nonprofit organizations and is also the founder of CAPED, which is Cancer Awareness Prevention Early Detection. And I'm also very pleased to tell you that CAPED has collaborated and partnered with us on this particular event. And we will be talking a little bit more about what you as audience members can do to join this movement with us. So may I request the screen share to be stopped, please? Mridu, I'm going to come right across to you. And thank you very much, first of all, for being here, and especially on your day off. But I know that you're passionate about this subject, and of course, we're delighted to have you with us. So Mridu, with your experience and all the work that you've done with cervical cancer, I'd like to invite you, first of all, to just sort of take us through what the landscape of cervical cancer looks like in our country today. And what do you think, or what do you see as the current status? So can we start with that? And
thank you, Smriti. Thank you, Pallium India, for having me over for this talk and for taking up the topic of cervical cancer. Yes, I'm very passionate about it, and when I start, I forget to stop. So Smriti, please feel free to tell me to stop whenever it's needed. So yes, and a happy Women's Day, if for no other reason than the fact that we come together and we talk about women issues. I found that in India, all the noise happens in January, which is cervical cancer month, and then everybody fades away. But this year, we are taking it forward, and I'm so happy that we are all here today on this day. So to all the women, all the work we've done, and for all the work we have to do. And cervical cancer is definitely one of the topics we have to look at, right? So like Smriti was saying, what is the landscape in India? India has the largest burden of cervical cancer deaths in the world, right? We carry 1/4 of the world's burden. We have the largest number of deaths of a cancer that is 100% preventable. Just think about that for a minute. We lose one woman every 7 minutes to 100% preventable cancer. Even one death is too many if it is a preventable cancer. And there are a number of countries that have managed to eliminate cervical cancer. Australia says 2025, we will eliminate cancer. Isn't it a waste of life? And WHO says that at the pace we are going on at, India will eliminate cervical cancer in 2110. That's 90 years from now. That's another 90 years of losing lives and slowly, incrementally trying to make changes to eliminate the disease. And we don't need to waste women. We don't need to waste lives, right? We can do it much faster. But to do that, as WHO says, you cannot have half measures, you cannot have incremental changes. We have to have something decisive and on point, which is what we are missing. You see, there is this whole campaign, Global Strategy to Eliminate Cervical Cancer, and it goes that 90% of girls till the age of 15 should be vaccinated. In India, if you see the sale of vaccinations, we have less than 1% of vaccines as compared to the girls, less than 1% girls vaccinated. And this is dependent on the sale of vaccines. We don't know how many were administered, but less than 1% of vaccine. How are we going to get to 90%? That is not a journey we are going to do by 2030, which is the SDG limit. The second pillar is that 70% of women over the age of 30 should be screened. Screening is a preventive measure because it can be prevented. You do early detection, which is screening. In India, 2021 data says 3.7% of the women in India have ever had a cervical examination in the country. We need to go from 3.7 to 70%. And they say 90% of abnormal tests after the screening should be treated, either for early cancer lesions or for treatment. In India, we're not even capturing that data. We don't have screening repository. We don't know how many women were screened and had an abnormal test and how many need to be treated. We don't have that data. 90% of the women screened, I'm sure we're nowhere close, but it's not even something we're looking at, right? That's where we are starting from. We have to do a lot of work. We have to have a lot of people coming in. We have to have comprehensive strategies. Yes, you can say Sikkim is doing things about it. Tamil Nadu is doing things about it. The government has created guidelines. Yes. But again, that is very incremental, very scattered. It is not comprehensive. It doesn't work together. It's not going to get us there. For us to get there, we've got to come together and we've got to do it. So CAPIT did a survey, All India survey, 21 cities in the country, and we were trying to figure out what is the understanding of cervical cancer. And we had 71% of the people surveyed had never heard about cervical cancer. And out of those that had heard about it, 21% thought it was a cancer of the neck, a cervical, right? So that is how low our awareness on cervical cancer. So if you don't know about something, there's nothing you can do about it. The first thing is that you need to know about what it is. You should have heard about it. There should be conversation around it, right? Now, we have seen, so before we go further, the fact that cervical cancer is caused by a virus. It's an HPV, human papilloma virus. And because it's a virus, it is preventable. I mean, with the COVID, we all know how the vaccination, everybody's waiting for the vaccination, right? We were all lining up for the vaccination. Similarly, with HPV, there is a vaccination and you should take the vaccination. But the point is that the HPV virus is a sexually transmitted infection. And in India, we don't talk about it so much. We started talking about HIV when everybody had made enough noise about it. We need to start talking about HPV. We need to start talking about cervical cancer. Till the time we don't spread awareness, you're not going to get people to go there and get screened or take the vaccination. So the first step is conversation and education. And then we can move on to even moving on to the 90-70-90 program that WHO has created. So that's where we are at present with India. That's how low our understanding is, and that's how low our figures are. But that is the gravity of the disease in our country. Smriti, does that cover your...
Yes, it does. Thank you, Mridu. Thanks very much for setting the stage for us. And I think what that really, again, emphasizes for us is how important these kind of conversations really are, where we have people, lay people and people, not even lay people. I don't think even a lot of people in healthcare are aware of all the different complex nuances that surround this particular disease. It is, like you said, most people are not aware of it. They don't know where it occurs. They don't know that it is a sexually transmitted virus. There are so many things that we still have to educate ourselves on. Mm-hmm. And it also, it amazes me how once it is articulated correctly, how people really step up and join. They want to join the movement because we're living in very uncertain times. There are very few things that are in our control. Here is something that is in our control and we can actually do something about. And I find it astonishing that if we really, get our act together, we can eliminate this disease in our lifetime. So that's something that's really important for us to remember as well. So we know that it's a gendered subject, and we'll be talking to Dr. Gopu in a bit about that. But before we do that, I want to actually take another perspective on cervical cancer, and that is the fact that it's not just a disease that physically devastates a woman. There are so many different aspects to it, and one aspect is her financial and social health. This is a disease that is painful. It results in malodorous discharge and all sorts of other symptoms. We know that globally there's an astonishing number, something like 40% of women who are abandoned by their spouses. So there's an impact on a greater scale as well. And so Navika, I want to come to you. You're an economist, and we know that for a woman, that allocation of resources for a woman's health needs are usually pretty much at the bottom of the priority list. And for her currency is her household work and, and the roles that she takes on. And this is a disease that seriously impacts that. So I'd like to ask you to talk to us a little bit about that particular angle, the financial and social impact of this disease on women.
Hi, Smriti. Thanks for having me on the panel. I feel really honored and privileged to be with the esteemed guest here today. And you're absolutely right, Smriti. I mean, health, like everything else in life, is also a social and economic reality. So you can't remove gender and economic aspects of your life from something as basic and important as health. And the problem with the way health plays out is that gender plays at every level. There's one story which I feel captures in some ways the problem with women's health and also largely with women's terminal health. And one, this is, it's actually a very old novel. It's by Pearl S. Buck, The Good Earth. There's this bit where Wang Lang, the main character protagonist, his wife has fallen ill, his first wife, and he's already prosperous and he has the second wife and everything seems lovely. And he hasn't even paid attention to the fact that his wife is unwell, his first wife. And she's continuing to do her caregiving activity. She's doing everything. And at one point she faints. And then he realizes that there's something wrong and they call the doctor. And the doctor also says, well, I'll give you 2 cures. One, which is, I'm not going to take any guarantee that she'll be cured, but it'll be cheaper. And the other one is more expensive, but I guarantee she'll be cured. And everyone in that conversation, including Olang herself, says, don't waste that money on me. I'm not worth it. Use that money for land, use it for something else. And that is the reality many times with illnesses for women, is that they don't think they're valuable enough for that treatment to be done for them. In India, we find, when you look at the economy, is that one of the most expensive illnesses is cancer, and the highest out-of-pocket expenditure which happens for cancer. But it's not just the expense of cancer, it's also the lost wages. And then the other thing is the caregiving activity. If I stop doing it, who does it? And the more you delay your treatment, the further you fall sick, and all these expenses also add up. And the unfortunate part is that if I'm ill, then the caregiver usually also is another woman. And sometimes, unfortunately, it's also the daughter who has to then give up her education. And because in India, we don't have numbers for any of these things, we never get these actual numbers. So, so much is invisible in India when it comes to women's labor and data, that we really don't know economically how much we're losing out. So one of the reasons there's a study which was done recently in UK, and I know the English economy is very different from us. But the reason I wanted to pick this out was, but at least it gave us numbers. So they estimated that women's cancer cost the economy about 1.4 billion pounds every year. And this is if you exclude just without mortality. With mortality, this number goes up to 7.6 billion. And what they also find is that once women fall ill, they don't go back to full-time work. So about 55% of women who do have cancer never go back to full-time work. And we already know that women earn less, work in sectors which pay less. And when you add disease and illness to them, we're further affecting their finances. And the scary part about this is I'm giving you a study from England because we have no numbers for India. We do have numbers of costs, in the sense that we know how much cancer costs, we know how much a family will spend on it. But because women's labor is almost invisible, it's either in the informal sector or it is caregiving, we don't really know the actual impact that it has on the economy. And so we have at the individual level, your families which are affected. And then at the economy macro level, also you have the economy which is suffering because of illness. And again, with cervical cancer, this just feels pointless because all this is just preventable. So if you just took the necessary precautions and valued women's health, and believed that screening is important, prevention is important, we could avoid so much, and in so many ways save so much for the country.
Wow, thank you, Navika, for putting that so clearly. And I think, sorry, can you hear me now? Is it all right?
Yeah.
All right. Okay. Sorry, is my connectivity all right? Great. All right. So I was saying thank you, Navika, for drawing our attention to that very important part, which is, like you said, invisible for most part. And also when we think about livelihood and opportunity, we also might think of the fact that in India, we also have this problem, right, where 55 million Indians are anyway pushed below the poverty line because of healthcare expenditure. And we also talk, the other invisible patients are, when there is resource reallocation within the family, who gets pulled out of school, who has to drop out of school, who has to give up a job, all of those things. And like we've said on different forums, that the illness of one person has multi-generational impact, both vertically and horizontally. So thank you very much for that point, Navika. We will come back to you with a few more threads that I'd like you to pick up. But for the moment, I'm going to go across to Dr. Gopukrishnan, who is a palliative care physician and also a senior public health specialist who is now with Swasti Health Catalyst. And Gopu has a lot of experience in working in sectors improving healthcare quality and access for some of the most marginalized communities in India. And several times I find myself having conversations with Gopu that really leave me, even more curious for starters, and also with a lot more information. So Gopu, we know that we've talked, I mean, it's been said now that cervical cancer is such a heavily gendered disease. And we also know that in all aspects, women are the last to take care of their health or to access healthcare in a timely manner. And I would think that, sorry, can we stop screen sharing, please? Thank you. And I would think that this health-seeking behavior or accessing health, it's not so much down to genetics as it is down to social determinants. And I'd like for you to please come in with that angle. What are some of the social determinants that lead us to this landscape that Mridu first articulated when we started off? And then I have one more question for you after you answer this one. Thanks, Gopu.
Thank you, Smriti, for that very kind introduction. I'm not sure I deserve that. And now I have to live up to that. So you're already putting me under stress. Yeah, it's I was also listening, and it's really informative, the discussions that we are having. I will specifically just touch upon one point each that Mridu mentioned and Navika mentioned. It also helps me set the context. So first was Australia's success in elimination. And so that's I'm not going to go into depth on that. So let's just park it there. And Navika mentioned invisible suffering. Now, the reason we are here is, like you said, our health systems are themselves gendered spaces. Just like our public infrastructure on the whole is gendered. Women's lack of safe access to public infrastructure, including education, public transport, healthcare, and in the absence of universal health coverage, where if you need to access health, you need to pay for it, the absence of financial valorization of women's labor, the invisibility of labor, which means lack of financial entitlements. So you're working, but you're not really considered to be, like one of our jokes, Smriti, you're not considered to be working unless you can't work anymore. And then suddenly you're working, right? So women's work tends to be not valorized, not acknowledged. And when eventually, and the story from the Good Earth, I remember that one. I remember reading that. So when eventually a woman asks for help, or her seeking help is acknowledged as valid, it is already at a point generally when her reproductive roles or productive roles are already disrupted. What would be the reproductive roles? Taking care of the elderly, taking care of children, sex, including taking care of the husband, physical intimacy, including taking care of the husband. So those are the reproductive roles. The productive roles, no one eats in the house if the woman is not well. The cow doesn't get fed, you can imagine. So at that point, and generally, and even today, because when before I came into this discussion, I was just talking to my partner, who is also right now, working with the MSF Cervical Cancer Project in Malawi. And I was asking her, look, these are my talking points. Do they make sense? And she just said, like, this is exactly the case. Like even today they have, and we are talking about Southeast Africa, which is area with the largest HIV and cervical cancer burden in the world. And even then, women will not take a day off to go and get screened because they're not sick, right? So how do we address this? So, and I just want to touch back upon Mridu's point here. So when we say Australia, or like, let's take any developed country that got to a degree of success, I would start with looking at what are the drivers of this success. If we say that Australia had a certain coverage, and I don't know the figures, maybe it's 90, maybe it is 85. If we say Australia had those figures in vaccination, what else did Australia have? So if we take from that, and generally this is a process we take in generally much of health system strengthening work. We look at what are the building blocks, right? What works basically, and what doesn't work, because there is a lot of work on, a lot of information on what doesn't work also. You take what doesn't work, you see if it's even actionable in the context you're talking about. So actionability, when you're talking about 90% in coverage, is that something you can possibly, practically, and Mridu actually elaborated on this better than I ever could, right? Like we are going at a certain pace, we are expecting to, reach a higher order of problem solving with the same approach, incremental changes. So the approach. So what would be the necessary preconditions to get to, say, if you want to get to 90%, what would be the necessary preconditions? And assuming we can get to these necessary preconditions in one context, are they replicable across the board? Assuming they could be replicated across the board, are they sustainable? And these are the 4 fundamental questions. And then we come to assuming they are replicable, sustainable, actionable. Are they cost effective? Are they time effective? Do we have to wait another 90 years to get there? And finally, so generally what we end up with these such exercises at the end of 2 days, you have a list of 87 action points. What are the 3 things? What is the one thing? If you don't focus on the 3 things and the one thing, you go back with better clarity and no action points. This happens also a lot. In the time that's given to me, I think, and tell me when the time is over, Smriti, of course. I would say the 3 things, I'm already going to park it out there, is, and this is from our experience with the COVID Action Collab. So I represent an organization which facilitated a collaborative, which at this point has 350 plus organizations and funding institutions within it. And so far we have delivered more than 11 million doses of COVID vaccine. So I know a thing or two about vaccinations. And the one thing we have found is vaccination is as much a social act as a medical act. And vaccination uptake comes down to at least 3 factors. Probably there are more. Firstly, it represents the quality or the history of engagement between the community and institutions, and not just health institutions. Secondly, it refers to information practices that are current in the communities. And thirdly, on individual rights and how they're acknowledged, how they're negotiated, and how they're balanced against rights of the public. If we look back into our own country's history in the 20th century, we have had, say, for example, the family planning. Now we know how that went. So there is potential for great good, but it can so easily end up harming. And all you need is not malice, but lack of empathy, lack of understanding. That's all you need. Lack of imagination is all you need to cause great harm. And what I would suggest as a starting point is the first one, we need to park, and this is information that is, again, at least for the past 4 to 5 years, there is a great clarity that cervical cancer has to be looked upon as part of a larger spectrum of sexual and reproductive health and rights, which India was one of the countries that did not even acknowledge the Gurmahar Lancet Commission report, which is on accelerate progress. But that would be a good starting point, because in a country of 500 million plus minus, give or take, women with around 50,000 gynecologists, unless we crack the primary healthcare aspects of sexual and reproductive health, you're never going to get to any targets. Unless we are going to put communities and people at the heart of how you problematize the problem. Because the way we problematize an issue also determines how we think about solutions. And what we do need is a change in the way we think about this problem. So what we have done, when we went to 11 million, and right now we are looking to go to 50 million with the COVID doses. And we are talking about a vaccine that, like you said, people are all waiting for, right? But the funny thing is, they only wanted it till it was not available. 3 weeks after vaccine was available, everyone was waiting for others to get it and see what happens, whether they're going to die, whether they're going to grow horns or whatever. So what we have understood is, to be successful in this, we need to think, if not in 90 years terms, we need to still be thinking in terms of a long road to gaining back trust, because mostly the communities that are most ravaged are the communities that have good reasons to be mistrustful of the health system. And the first and the long journey would be to regain the trust of communities, and that would be by being available to support communities in solving what they already feel are their problems, rather than go to communities with a cure they don't understand, for a problem they don't see. That would be the long run that is required to get to solutions. I'm not sure if that answers to your questions, but I'll give it back to you.
Gopu, thank you. There were many remarkable insights in there for us to take note of. And I completely agree with you that there has to be community participation, one. And two, what you ended with, the paternalism that really afflicts us, is something that we need to work around. And it works itself into our practice in very insidious ways. And cervical cancer being what it is, where it's already the disempowered women who are experiencing it, to go in with a paternalistic approach and attitude, I don't think is going to get us very far. So thank you very much for that. I think all of us who work in these different spaces, whether they're in policy, whether they're in health, whether they're actual, on the ground work, we do it for various reasons. And I remember, being at one of these policy workshops where it's actually very easy to get very cerebral as you keep entering those spaces. And it is really, really important to remember why we're there. And I remember this was brought home to me by one of the stalwarts of palliative care in that room. She was this wonderful lady from Rwanda, and she said, never forget the face of the person who brought you into this space and for whom you are here. And on a personal level, for me, it was my mother who died of cervical cancer, and it was an extremely, extremely painful death. So to us, I think the importance of having the voice of someone with a lived experience really guide us is so important. And for that, I would like to invite Sanghita Gupta, who is here with us today, who is amongst many accomplishments, she's been a cervical cancer survivor. And Sangeeta, what I'd really love for you to talk to us about is about your own journey, and specifically about the conversations that you had along the way that were the ones that, allowed you to make, not allowed you, or enabled you to make certain decisions for yourself, or some of the conversations that were challenges or difficult conversations that you had along the way. So Sangeeta, welcome, and we're really glad to have you.
Thank you so much, Smriti. It's such a pleasure to be with you, and thank you for giving me this platform to share my experiences. Am I audible?
Yes, you are.
Okay. Yeah, so I got it 20 years back when it was almost unheard of. And as Mridu has rightly said, cervical cancer was actually, thought of as the cancer of the cervix, which is, like your neck. So even I hadn't heard of it, although, I'm like a little well-read and everything. Still, I didn't know that there was something like cervical cancer that existed. So it started with some kind of discharge, foul-smelling discharge, and then it went on to some, bouts of unexplained bleeding and all. So that is what alarmed me, and I went to the doctor. But the discharge did not really alarm me, because I thought it was just some kind of a urinary infection. So, I feel that there should be an awareness campaign where we talk about what are the symptoms of cervical cancer, because most women don't even know what the symptoms are. And then I went for the pap smear, And I was diagnosed with the cancer, and my complete hysterectomy was done. 3 months later, I had a relapse of the cancer, and that was actually very scary because by then I had read about it, and those were not the days when Google was so rampantly used, and everything costed money. Even a mobile phone was charged, your incoming, outgoing, everything. So anyhow, I read about it, and that is when I came to know about what actually this cancer is and how you can diagnose it. And that a pap smear was a screening that should be done for women over 30 years. Anyhow, so this is how it happened with me. And again, as Mridu rightly said, for some time, I didn't know who to really talk to about it, because it is considered a sexually transmitted disease. And there is a certain kind of stigma attached to it. So if a person like me was finding it a little difficult to talk to people and tell them that I had cervical cancer, although it not any fault of mine, it could be transmitted through if you share your towel with anyone, like when we go to hotels, we could have shared a towel which was not, or maybe with a pap smear or with some checkup where you got it. Like HIV can be transmitted in other ways too. So anyhow, my father-in-law is a doctor in Gangaram Hospital. So I then went to him, which also surprises people. Tune apne father-in-law se baat ki? Like it's like in our country, it is like, you're talking to a male about a disease which is associated with the women, like breast cancer or cervical cancer. So yeah, I did go and talk to him, and I told him that this was what was happening, and he immediately took action. And then I underwent my radiotherapies and chemotherapies and everything, and I was cured of it. And while I was undergoing the treatment, so as Navika has very rightly said, there were times when I used to feel very low because it is not an easy treatment. And there are times when it is so painful that you want to actually give it up. You feel it's not really worth it. So, you don't want to talk to your family about it, your friends, your loved ones about it, because you don't want to put them under more distress. So my doctor, thankfully, Dr. Jayalakshmi, was a very, very compassionate, very nice person. I spoke to her about it, and she used to tell me, Sangeeta, do you know how many women are not taken care of? The treatment is withdrawn in between because they feel that there is no point in spending money on a woman, which is such a sad reality in our country. And she used to say, you are so fortunate. Your husband accompanies you every day. There are women who are coming alone for their treatment. And it is, like, these are the things which make you feel that you are so fortunate, and you have to fight it. You have to have faith in God. You have to be positive. You have to just not let go, is what I would say. Because if something is curable, if something is, there's so much support for you, your family, your friends, everybody is there for you. And I feel the people who are negative, you have to just ignore them, and you have to value your life, because you don't get it every day, right? Like anybody else, you also get it once. So you have the right to live it, and you have the right to get yourself cured. So I think this is a message that needs to be conveyed to the women, that don't be shy of talking about the health problems. Don't put yourself at the end. You have a duty towards yourself also. So my only thing is that, yes, I would like to convey to the women that please do your duties towards yourself also with your family, and please don't feel shy about talking about your health issues.
Thank you, Sangeeta, and thank you for sharing with us so candidly. the fact that cervical cancer affects women in their sexual organs, it has very powerful emotional and cultural associations. We know that. And especially for women in low and lower middle income countries, a woman's ability to be intimate with her partner, bear children, all of those things really sort of determine her station in her family and in her community, right? And so in every way, cervical cancer directly affects this domain, and very often it leads to women losing their status, whatever that might be. Now, the fact that somebody found it absolutely, bizarre that you had this conversation with your father-in-law, even though he was a doctor, I mean, that speaks volumes about our attitude towards this. I would also say that, in the cultural rhetoric around a woman's sexual organs and diseases that are associated with her sexual organs is in and of itself the taboo, the barrier to talking about it, right? And what we are really surrounded in now is this veil of silence. And we also know, like from anecdotal evidence, that from healthcare workers who organize screening and vaccination camps, that it's often the person that accompanies the individual who make a reference to the difficulties faced by the woman, and it's not her talking about it directly. Now, this brings me back to a point, and I want to come back to Mridu with this. Mridu, we're doing this on Women's Day. It's a disease that affects women in their reproductive organs, all of that. What can men do about this problem? You're on mute, Mridu.
Sorry. Yes, the big question, what can men do about it? So when we say that it's a sexually transmitted infection, obviously men are half the problem. So they are definitely half the solution also, right? So I want to tell you that when we work in the field, we cover Punjab, Haryana, Delhi, NCR, and we're moving towards Rajasthan now with our screening. So when we find a woman who is over 55 and she has her pap test is abnormal, we want her to go in for further tests, we get a lot of resistance from the family, right? For them, it is, if it's cancer, it's death. That's the understanding in rural India, that cancer is this really terrible disease. So, she's older, and there are going to be so many now chakkars of the hospital and whatever. So the sons will back away. They're not going to send their daughters-in-law with the mother, right? So the sons will back away. The husband does not have the time. Dihadi kategi, agar you have to take her, you'll have to take her multiple times. And they just let it go. It's the inconvenience of taking her through treatment that has them backing away. This is free treatment. We're talking about government support. They're going to get you the government schemes. You're going to AIMS or Saptarjang or whatever. It's not, there is no cost involved, but just the inconvenience and the time, they will back off. If she's younger, they will still make an effort. So when even 55, and that scares me, because that's so close to my age. I value my life yet. If at 55, if the family had to back off and say that, you're just not worth it anymore, that is really scary, right? So the men have to realize, we've done a whole campaign, if you see on Twitter and Facebook, where we have men to end cervical cancer. And every time we have a talk like this, I tell them that, yes, the women here, we're talking with layman's language. The women need to go and speak to a gynae, get yourself screened. If you are in the vaccination age, get yourself vaccinated. And the men need to go home and speak to all the women in their lives. Please talk to them about it. Tell them what you've heard here. Let them know what this is. Somehow enable treatment, care, screening for the women, right? There is, HPV does not only affect women. It is not only cervical cancer. HPV causes many cancers, even in men. Oral, penile, anal cancers, vaginal cancer, multiple cancers are caused by HPV. So it's not like the men do not suffer. There is just no test. There is a study currently about a urine test for testing HPV, but it's not something that is being offered. But otherwise, it is the cervical, the pap test, which detects HPV. Therefore, the onus is on women to go and get tested and to be treated, which does not mean that it doesn't affect men, which does not mean that you don't need to be careful, right? Being sexually aware, knowing about your sexual partners, using protection. These are some of the basics. Being aware of symptoms in yourself or in your partner. ensuring that you are talking about it and you are opening communication with the women in your home and in your family is very important. In rural India, we say men are the deciders. We did a study and it was largely the husband or the son who had to take a decision for the woman, right? So educating them about cervical cancer, about the symptoms, about how it can affect the rest of the family is very important, because men are the ones who will actually make a decision. So all of these things are equally important to eliminating cervical cancer, as is actually going and getting the test done, right? So we, in our conversations about cervical cancer, when we do it with corporates or we do it in schools and colleges, we always insist that you have men and women. It may be, we may be talking about cervical cancer, it affects only women, but this is HPV, and HPV affects everyone, and all men need to be part of this. The fact that we do, even in schools, if you remember, I don't know, at least in our age, the schools, if we had to talk about menstruation and all, the girls used to be taken away, and we would have the sexual education for the girls, and the boys would be out playing or something. We've always done this, we've segregated them. And we think that this is a women problem. It is not. It is our problem. We all need to talk about it. Women need to be screened for it. Vaccinations around the world is for boys and girls. In India, currently, it is only for girls. That's what the Pediatric Society's webpage says, that girls need to be vaccinated. But otherwise, the vaccination is for boys and girls. My son had to leave to study in the US, and one of his mandatory vaccinations was the HPV vaccine. I had to go looking around for a doctor who would vaccinate him. You know, ladka hai, why do you need him to be vaccinated? 18 saal ka hai, usko why do you need? And I was like, it's compulsory, you know how they are, so just vaccinate him. It's that difficult to get a boy vaccinated. But otherwise, yes, it is our problem. Men have got to step up, talk about it. Ask for a vaccine, you'll get a vaccine. Ensure that you are aware of cervical cancer, you are taking all the precautions that need to be taken, and you are doing it for the women in your family. Men, absolutely important, they become part of our conversations now.
Thank you. Thanks, Mridu. Thanks so much. This is, again, we're looking at that intersectionality, and I see that Gopu's put his hand up. In fact, I was just going to make a reference to something that Gopu said earlier. Even things like, you know, public transport, the sense of safety a woman feels in going even to a screening camp. If it's in another village, she's not going to make that journey on her own. And so how do men facilitate? Just to say, go and get screened is not enough. There are very simple, practical ways in which you can make this happen. In accompanying a woman, in actually making that appointment, helping her take that day off. And what was said earlier, she's not sick. I mean, preventive health, like preventive measures. She's not sick yet. So why should she spend a whole day just going somewhere and getting checked for something she may or may not even have, right? So those are the conversations, and those are the barriers also that get in our way. Gopu, you wanted to say something, you had your hand up.
Quickly, sorry for barging into the question, but the single most important thing that men can do is, it's a negative, answer is a negative. Remove all obstacles to meaningful life choices. That would be education, around employment, around marriage. Because in India, nearly there is an 80% chance, I mean, this is not from India, but there are studies that nearly there's an 80% chance of getting HPV infection, even when you have only one partner. And so the focus on cervical cancer or HPV as a women's health issue goes into a long tradition of pathologization of female sexuality. And we need to call this one out. And this is harmful to both men and women. So like Mridu said, men need the vaccine as much as women. That's one. And on the side of women, the stigma associated with HPV vaccination, because mostly we are looking at girls of a 9 to 14 original age. And there's a moral panic that goes around with the idea of, let them take a vaccine for an STI. So there's sort of conflation of cervical cancer vaccination with female sexuality is one of the biggest hurdles we have. And it doesn't have to be that way. So girls are forced into early marriage because they don't have meaningful life choices, because they can't go to school safely. Gender-based violence is a risk, and therefore parents get them married off. And there is also the inability to negotiate safe sex within relationships, married or otherwise. Let's not even go into marital rape and where we stand with the law on that. And sexual violence is much more likely to lead to transmission of STIs, all STIs. We know this. So for me, the biggest thing that men can do is to let the women in their life have genuine opportunities. Don't even have to think about cervical cancer. One of something that has stayed with me from many years back from my teacher is take care of the small things, the big things take care of themselves. Thank you.
As the only man on our panel, I can't tell you how wonderful it is to hear this particular framework coming from you. Thank you, Gopu. Thank you so much. I'm just going to come back to Navika. I have one question. It's a little bit, where I'm curious to know that what are the data sources that are publicly available on health data, and do they cover issues related to women's health? You alluded to that earlier. I just want to, understand that a little bit better.
Smriti, I think this is one of the biggest problems that we actually do have in our country. We don't really have much publicly available national level data. And to add to our problems, because of COVID, this year the census also has been delayed by 2 years already. So you don't really know what is large scale and across the country. And when you can actually count on your fingers the number of limited data sources that you have. One is NFHS, which we're all dependent on all the time, but even NFHS 3 didn't have enough. I mean, you would get one NFHS after 10 years. So, I mean, in the recent years, they've been more regular. And they also, the problem with a lot of them is they're limited in the questions they can ask and the sort of data that they do gather for you. And one of it is also that you don't have the resources. It's not easy to be in a village and actually do more detailed tests. But we are also in a system where you have like an entire public health system which is functioning, which is also connected in some ways through HMIS to a larger network. This is all data that you have, and this could be used to give us better data on what's happening at the field level. Like this could be used to see what is the spread of a disease, what is the disease surveillance. And there is a huge discussion on anonymizing data, and that is, health data, I completely agree, has to be as private as possible. But we don't need identifying data. At a government level, you don't need to know if Navika has cervical cancer or Radhika has cervical cancer. But just to know that there are 2 women in this particular village who have cervical cancer itself will bring out so much of a change. Just getting to know numbers would be such a big thing. And we can use our systems which are already in place, anonymize the data, ensure privacy of our patients, and make sure that this data can then be used for better policy and policy setting. And I think this is something which we really need to somehow push for and sort of get people to work around it. Yes, a lot of the data collection is a difficult exercise. I agree with all that. But what we at least have, we start working with that more. We start pushing for better data, to have policy which is more data-driven with better evidence. And let us start counting our women. Let's count women who are unwell. Let's not leave them as invisible. If there are 5 women who are unwell, they are also part of the country. Let their numbers come in. I think that's one of those effects that data has. When you immediately see those numbers, you realize that there are those 5 human beings. And I think that is really important in sort of looking at our health system right now.
Thank you, Navika. Thank you for humanizing the data. That's what's really what I'm getting from what you're saying. There are a couple of other points.
Line, if I may, I love that line. Let's count our women. Absolutely, let's count our women. Every one of them.
Wonderful. Thank you. I'm just going to take 1 or 2 audience questions a little later. I see that they're sort of there are some questions in the chat box, but I wanted to touch upon one important thing. While we engage in this whole discussion and this pursuit of cervical cancer elimination, we cannot afford to forget how many women already afflicted by it. And the fact that they present it, all these things that all of you have talked about, the health-seeking behavior, the barriers, the lack of conversations, the lack of accountability, and all of those things. We end up getting women presenting very late. And what that means is that they go through some extreme pain and discomfort. It is one of the most painful cancers in the world. It's most difficult to treat this pain because of just its location, the nerve endings, and all of those things. The fact that, after a while there are fistulas, there are all kinds of things. And let's remember that in a large part of the country, women don't even have access to menstrual hygiene products. So, all of this is compounded. I just want to, spend a few minutes, and this is again, Gopa, I'm going to come back to you before we also go to Sangeeta. You're a palliative care physician, and you have no doubt treated women suffering from cervical cancer. And what can we, as, I wouldn't just say as palliative care providers, but even anybody who's in this conversation, what can we do to ensure that, they get the palliation that they need? And where is this available?
It's a big one, Smriti. Palliative care is available, but palliative care is, like we said about cervical cancer, among cancers, palliative care is among health services the most invisible. A good point would be to most teaching hospitals would have a palliative care department attached to them. There are wide variations at the state level, but at least in Kerala, there is, as you know, there is a robust movement at the community level. So many, many taluk hospitals, for example, have some sort of facility around palliative care, but the quality varies, and there is always a trade-off between access, because you need it at your home, and maybe the kind of quality that you can get in a hospital setting. I don't believe that there is any standardized map as yet of the different facilities that are available at city level. This is something that should be taken as a priority. We always know, of course, the helpline from Pallium, and we even reached out to many of our own patients with COVID grief. We supported them to reach out to your Sukh Dukh helpline. So on the whole, we are getting to a point where it's easier to find a provider, but there is a long way to go. I believe there was a second part to your question.
No, so I think you've answered most of it. But I wonder if, I would say this as a caregiver of someone who died of cervical cancer. It was brutal. By the end of it, we wanted her pain to end, and at whatever, even if it meant death. And I find that was 22 years ago when my mother had it, when I was 19. Last year, I lost a very, very dear friend. And the difference was that my mother might have been in the Nilgiris, in a remote district, with not too many healthcare facilities. This girl was in Delhi. She was in Delhi. She was my age. She, and it was just unfathomable to me that in these 22 years, actually nothing had changed in these two women's stories. And so here, what I'm trying to do, I suppose, is, draw that line from prevention, treatment, management, and palliation. Right now, yes, we can prevent it. But while we work on that, and we know that, there are several things that need to work in lockstep for that to happen, let's not forget that the women who are already afflicted with cervical cancer, who are in pain, need access to palliative care. And that's something that we all need to also talk about to bookend the issue. Sangeeta, I would like to.
Would you want me to respond on that? Or
yes, please, Gopu. Yes.
See, there is a gatekeeping when it comes to cancer care services that prevents people from getting palliative care, and that needs to be called out. There are some stories that I have shared with you. Palliative care as a service is not seen as something that fundamentally adds value, but is more seen as something that is a good add-on by many mainstream healthcare facilities and providers. Whereas there is clear evidence that early adoption of palliative care not only improves the patient's journey through the health system, but also improves treatment adherence. Like Sangeeta said, there are periods in which she wanted to leave. And I wish there was someone, and I have had patients with that. I have had patients who in morning rounds, when you come in, say, I just want to die, send me back to my village. And in many cases, there is a problem that can be addressed, which will be addressed, and the patient wants to continue with their treatment. And therefore, early availability of good quality palliative care improves adherence to curative treatments and therefore overall life expectancy and treatment outcomes. So that's one. I think we should give over to Sangeeta at this point. Yeah, thanks.
Thank you, Gopu. Thank you. That was a very important point. Just in the interest of time, I can see the questions coming up, so I want to spend the last maybe 10 minutes which we have answering those questions that the audience have posed for us. But Sangeeta, before we go into that, having been through this journey yourself and with all of this conversation around how difficult this is to talk about, what can you tell us about available support groups, support systems for women who are currently experiencing this journey? And is there someone they can reach out to? Is there a network of people who are there to have these conversations as peer support groups? Because it's not always easy to have this conversation with your family members or with, even with the healthcare system.
See, honestly, I was very fortunate to have a friend and who also was undergoing ovarian cancer. She also had cancer, along, we both had it almost together. And we used to, sit together, share our problems together, and we used to walk together and do whatever little we could. And also, there is no harm in taking help from your friends or family members who are always willing to help you, not in the sense of emotional support, but also other support. Like, for instance, I was teaching when I got the disease. And obviously, as the treatment progressed, I had to give up my job. But there was a friend of mine, my husband spoke to him, and he said, Sangeeta is feeling very mentally disturbed because she is not mentally occupied. So he was working in a publishing house. He immediately started getting work for me at home. He taught me how to edit. And that is how I started my journey as an editor. So there are people who are willing to help you, provided you actually reach out to them. So firstly that, and then there are many social organizations today. At that time, there was nothing, because as I said, there were no ways to connect with other people, right? Your only connection was with your family or friends or known people. But today we have, it's a global thing. Like, you can easily reach out to organizations like Pallium, like you people are also providing support. Then we can maybe, like patients like me, I don't have a problem if, we can have some patients who want to talk about it, who want to, see, honestly, a lot of your mind work also plays an important role in this. You have to be positive. You have to make your weaknesses your strengths. Like my daughters, I had two young daughters. My elder daughter was in fact 19 only when I got it. And they were still in school, and it was a major setback, right? So initially it was like they were becoming my weakness. I thought that I was going to leave them. What is going to happen to them? This, that. And then I told myself, I said, no, they have to become my strength. I have to fight the disease to be with them. You see, so there are a lot of factors, and these are things which you can talk to a person who's already gone through it. And, maybe sometimes it does help. As I said, Dr. Jayalakshmi was really instrumental in bringing me back from the distress that I was going through, right? So when she would tell me stories about the people who were not treated well, who had to withdraw in between, and, these kind of things, I realized how fortunate I was. Every day I would thank God for giving me a family and the kind of environment where I was so well looked after. and friends, and my sister who flew down from Udaipur, leaving her child and her work and everything to be with me at this time, and my entire family, everybody, So there are people who are there for you, and you have to learn to live for them. You have to fight it for them. This is what I feel, So yeah.
Thank
So
you,
there are
Sangeeta.
certain things. Yeah.
Thank
so
you.
okay.
Thank you so much. This is an important piece that you have to also reach out. There is help available, but it's also taking a step in that direction, which is probably one of the most frightening steps somebody has to take, because very often reaching for help or asking for help is an admission that you have the disease, that you have the illness, and that may be a very, very difficult thing to come to terms with at a deeply spiritual level, right? But once we get past that, yes, help is at hand. I'm going to just take a quick, let's just try and take some of the questions in the chat box. Can unmarried women of 25 years and above get the vaccine as well? And I'm just going to let any of the panelists answer this. You can just unmute yourselves and answer the question. And what is the minimum and maximum age for the HPV vaccination? Shall I just, Mridu, would you like to answer that?
Sure. So WHO standards say that it is best to get the vaccine between the age of 9 and 15. So if you're between the age of 9 and 15, you need 2 doses of the vaccine. If you're between 14 and 16, you need 3 doses of the vaccine. The vaccine can be taken till the age of 26. Speak to your gynae, speak to a doctor if you want to take it, if you're over the age of 26 and you want the vaccine. In India, the vaccination has been given to women at the age of 45 also, but speak to a gynae, because the efficacy of the vaccine goes down as you become older. Let your doctor decide for you. Otherwise, till the age of 26, they will give you the vaccine. If you're over 15, you need to take 3 doses. That's the gist of the vaccine.
Thanks, Mridu. Here's another question, and I think, Gopu, I'll ask you, where can we get access to testing facilities in India, and what is the procedure for testing?
The most common testing is the pap smear testing, which is available in all secondary health facilities. You can go to any gynecologist and get the testing. In a camp setting, there is visual inspection, which is sometimes done by field level staff. But the current recommendation is for DNA and mRNA based screening, which may not be that widely available in the country. But the pap smear is still a very acceptable.
Okay, thank you so much. And there's another question, which does the Indian government have a drive for teenage girls to be vaccinated for HPV?
No.
It's long and short of it. All right. Okay, I see that we've answered all the questions. Thank you very much. And we're also at the last 5 minutes of this conversation. And there's something very important that I'd like to invite Mridu to talk about, which is what can we do now? And those of you who've attended the webinar, we've talked about all the different structural issues and the issues that that plague this particular disease that have very deep roots. So we're not, we can't unpack all of it right now, but what can we do right now that can build this movement? So Mridu, there is something that you could share with us.
Yes. So there are 2 things that you can do. One is that you can take care of your own health. You can pledge immediately today to do something about your health. And I always say this at the end of a talk: go and get screened, or go and get vaccinated, or go home and talk to everybody in the house and make sure that they are doing something about it. If you're a man, see a doctor. Also, I think there is a link that will be shared on the group. We have a page which is a health pledge. And if today, starting on Women's Day, if you can go to that page and take a pledge for your health, pledge to do something about it today, either for yourself or for your loved one. us. Go and take the pledge. And when you've done it, let us know you've done it. Let's collect people who are doing something positive about their health rather than listening. Do you know there is a research that says less than 5% people will actually get up and do something, even if they know it's good for them. Like you might know you have to get to the gym, but you're not going to get to the gym. And you know you've got to get on a diet, but you're not going to get on the diet till something doesn't happen, right? So less than 5%. Why don't you become that 5%? Every one of you who are listening to us today, go and take the pledge and then make sure you do what you pledged to do and let us know that you've done it, right? So if somebody can share the link, Smriti, there is a link to the...
Yeah. It's been shared. It's been shared now.
So you go and do something about it. And the second thing you can do is become an advocate for this movement. Talk about it. Everywhere you go, find 10 people that you can talk about this movement. Get them to take a pledge and get them to do something about their health. That's all you have to do. Is that good?
Absolutely. Thank you so much, because those are clear, actionable things that all of us can do. We're not asking anyone to do something, that's going to take them outrageously out of their way. These are things that can be done. Schedule that appointment, have that conversation, get your children screened, get yourselves screened, get your children vaccinated. I'd like to start winding our conversation down now. And I just really want to thank each and every one of you panelists for being here this afternoon and really making this such a rich conversation. Every single point that each of you has made is absolutely vital in piecing this entire story together. I think today we've seen cervical cancer from all these different angles. We've gotten a holistic view to what cervical cancer is, how it impacts people, what its origins are, what makes it worse. And I suppose it's important for us to remember that the end is in sight. It is within reach. We all just have to do this together. I still, I find it remarkable that the polio vaccine was developed in 1961. And by 1979, in just 18 years, it was eliminated in the US. Polio was eliminated in the US. And by 1991, which is in 30 years, it was eliminated in the Western Hemisphere. That's less than one generation. So I think, this is something that we should all get behind. And the fact that you're here on an evening, having this conversation with us is very heartening. So thank you all very much for joining us. Take that pledge, go to the page, go to the CAPED page. There's a lot of information there about cervical cancer. If you like, we will also send you an FAQs list of all the questions that you might have that you haven't asked or we haven't answered for you. And we're happy to share that with you as well. And if you feel like someone would benefit from it, please use the telehealth helpline numbers. There is help available for those who need it. So thank you all very much. Thank you, Sangeeta. Thank you, Navika, Mridu, Gopu. Thank you very much once again. And thank you to the tech team at Pallium India and the team at CAPED for making this happen.
Thank you, Smriti. Thank you, everyone. Thank you so much.
Thank you, Smriti. Thank you.